Hood.
Thank you, Mr. Chairman, for having this hearing. I want to welcome our witnesses here today. As I travel around my district in Illinois, central Illinois and northern Illinois, I continually hear about the rising cost of health care from families and farmers and workers and small businesses throughout my district. Premiums and out-of-pocket costs continue to put pressure on household budgets, and too many of my constituents feel like they're doing everything right but still falling behind. While our healthcare system and its costs remain complex, and we've heard that today, health insurers play a critical role within our system. By pooling risk and negotiating on behalf of millions of Americans, insurers shape what care patients can access and at what cost. Ultimately, I believe competition and transparency and innovation are the best tools to lower costs and improve care. But when markets become unreliable and manipulated, we have seen that those benefits don't always reach patients. Much of your testimonies here today address factors other than insurance practices for the rising cost of healthcare. However, I view this as a comprehensive system where everyone shares responsibility to patients and families. We've also heard a lot about consolidation in healthcare and health insurance, both vertical integration with PBMs and medical practices, as well as large-scale horizontal consolidation of insurers and its impact on patient choice and prices. In theory, this consolidation should make it easier to obtain lower prices from providers as your market power increases. Mr. Hemsley, my question is for you. UnitedHealth covers roughly 53 Americans across this insurance business, across its insurance businesses, and processes hundreds of billions of dollars in medical spending each year. You are the largest purchaser of hospital and physician services in the country. What challenges do you see as preventing you from lowering prices during negotiations despite your sizable and increasing bargaining power?
I'm sorry, that's an excellent question, and one in terms of real market reality. Our presence in the marketplace is leverageable in terms of getting good price and value for healthcare, but there is meaningful concentration in some markets, and you need to provide sufficient access. So to achieve that level of access, where there is concentration on the care health services side, health delivery side, there's only so far you can go so that you can make sure that people have the resources to go to for their care. And that creates a practical limit in terms of what you can do from an economic point of view.
I want to switch to Medicare Advantage. Medicare Advantage, as we've heard from a few of my colleagues today, has become a popular choice for millions of seniors because it offers coordinated care, predictable costs, and additional benefits that traditional Medicare often does not. When it works well, it can deliver strong value for beneficiaries and taxpayers alike. At the same time, issues have been raised ranging from allegations of improper practices like upcoding to real-world challenges seniors face navigating enrollment and coverage changes. My office recently assisted a constituent whose approved surgery was put at risk because of confusion about open enrollment and conflicting plan information, requiring my staff's intervention to avoid a lapse in coverage. Unfortunately, that is not a unique experience. These kinds of situations underscore how important clarity, accountability, and patient-centered administration are in Medicare Advantage. It's our responsibility on behalf of millions of Americans who have chosen Medicare Advantage plans to prevent this and address faults within the program. I ask this for any of you on the panel that wish to answer. What steps are you taking now to ensure Medicare Advantage continues to serve as a valuable and affordable option for American seniors? Not all at once.
Well, I'd go back to the points that I was making about getting a digital health record, changing the payment models to pay for outcomes, eliminating kickbacks. So the things I mentioned about Blue Shield of California members now can access a digital health record, which is what we're using to do the automated prior authorization, and we have gone to our own pharmacy model, which has saved some money. So there are some things that we are trying to do, and I do believe, and I'm happy to work with you, Congressman, on things that we could potentially change in the rules of the program to help support that.
Anybody else?
Again, I would use value-based care as the principal direction for Medicare Advantage.
Thank you. I yield back.
Ms. Sanchez.
Thank you, Mr. Chairman.